If you are a man over 60, I need you to picture this. You have spent years eating correctly, focusing on greens and bright orange vegetables, feeling certain you are protecting your health, especially your prostate. Then, during a routine checkup, your PSA is slightly elevated. Or perhaps you begin to notice a change in the bathroom, a flow that is not what it used to be. You are doing everything by the book, yet your body is sending a signal you cannot ignore. What if the very foods you trust to protect you are playing a different role in your body now? What if a common vegetable, one you consume weekly, could be quietly altering your internal environment in a way that might encourage cancer cells to grow? Please understand, this is not about vegetables being bad. They are not. This is about a profound truth we are only now fully appreciating. Your body after 60 is different from your body at 40. The way your liver processes food, the delicate balance of your hormones, and even how your cells repair themselves have all evolved. Your nutritional needs must evolve with them. If this topic is already resonating with you, and you are committed to taking charge of your health, please take a moment to like this video and subscribe to our channel. We are dedicated to providing clear, evidence-based guidance every single week to help you stay strong and informed. My name is Dr. Katherine Rocker. I am a urologist, and I have dedicated over 20 years of my practice exclusively to the health concerns of men over 50. I have walked with thousands of men through these exact questions. I am not here to make you afraid of your food. My goal is to empower you with knowledge. Today, we will look at 9 common vegetables that need a second look after age 60. For each one, I will give you a simple, clear, and safe plan so you can continue to enjoy them without a single worry. You can absolutely keep these foods in your life. You just need to know the new rules for your body. Let us talk about vegetable number 9, broccoli. We all know it as a cornerstone of any healthy diet. But for the aging male prostate, its powerful phytochemicals do not just support detoxification, they can actively alter the metabolism of your sex hormones. The compound inside broccoli that makes the difference is called sulforaphane. It belongs to a group of plant chemicals that make your liver work harder. When your liver speeds up in this way, it changes how fast certain hormones and drugs leave your system. Androgens, which are natural male hormones, can shift up or down depending on how strong this effect becomes. A big shift can alter the balance that helps keep prostate cells in check. I see this often with men who take medication for the prostate, the heart, or blood thinning. These medicines rely on a steady level in the blood. Broccoli can speed up how your liver clears some of them, making the dose less steady than your doctor intended. The hormone shift can create the right conditions for prostate tissue to grow more actively. The goal here is not to eliminate broccoli. The solution is consistency and communication. I see men who go from eating no broccoli to having it every single day. That sudden switch is what causes problems. A steady, moderate intake allows your body to maintain a stable hormonal baseline. Aim for no more than 1 cup of cooked broccoli about 3 to 4 times a week. This pattern gives you all the fantastic anti-inflammatory benefits without starting that hormonal roller coaster. I also strongly recommend you avoid concentrated broccoli sprout supplements. Another very common vegetable, a bright orange snacking staple, works through an entirely different cellular pathway. Carrots. This vegetable is famous for supporting good vision, and we have its beta-carotene content to thank for that. But what if this very compound, in excess, can send confusing signals to the prostate cells responsible for knowing when to stop dividing? When you eat carrots, your body turns beta-carotene into retinoic acid. Retinoic acid works like a switch that helps cells know when to grow and when to rest. That switch is part of a delicate balance in your prostate. In an aging prostate, where cellular repair mechanisms are slower, excessive retinoic acid can disrupt the off switch. When that happens, prostate cells can multiply more freely. Let me be very clear. The risk does not come from eating a whole carrot with your lunch. The concern arises from 2 specific habits: taking daily high-potency beta-carotene supplements and drinking large quantities of carrot juice on a regular basis. These practices deliver a concentrated megadose. You can confidently continue to enjoy whole carrots as part of a balanced diet. The key is to avoid juicing them regularly and to completely bypass beta-carotene supplements. Pairing carrots with a source of protein or healthy fats slows down how fast beta-carotene turns into retinoic acid, which makes its effect more even. Now, we turn to a leafy green. Kale, the king of the superfood greens. For men over 60 who are proactively taking calcium or vitamin D for bone health, this vegetable needs a little strategic planning. Kale is high in a natural substance, oxalates. These oxalates latch onto calcium in your digestive system. In a body where kidney function has naturally slowed, this can lead to a slight but persistent rise in calcium levels in your blood. Your body detects this, and, in response, it makes less of the active, powerful form of vitamin D. This is a problem because that active vitamin D acts as a crucial brake on prostate cell growth. By creating what is essentially a false reading of high calcium, you are inadvertently telling your body to ease up on producing one of its own most important natural defenses. There are simple ways to keep kale in your diet. You simply need to be smart about when you eat it. I advise my patients to space their kale meals and their calcium supplements apart by at least 4 to 6 hours. Lightly steaming your kale, instead of eating it raw, can also lower its oxalate content. The most important step is to talk with your doctor about getting your vitamin D and calcium levels checked regularly. Let's discuss sweet potatoes. Nutritionally, a sweet potato is a powerhouse of dense carbohydrates, and this has a direct consequence for prostate health. A large baked or roasted sweet potato has what we call a high glycemic load. This means it can cause a significant spike in your blood sugar and insulin levels. This surge then triggers a corresponding rise in a substance in your body known as insulin like growth factor 1. Think of insulin like growth factor 1 as a powerful growth signal. It tells all kinds of cells to multiply, including any silent, latent prostate cancer cells that may be present. For a man over 60 whose body may not manage insulin as efficiently as it once did, this repeated stimulation becomes a persistent command for cells to grow. The key is to change how you view them on your plate. Treat them as a treasured side dish, not the main event. Keep your portion to about half a cup. Always pair them with a good source of healthy fat, like a drizzle of olive oil and a lean protein. This combination dramatically slows down the sugar release and softens that insulin spike. Next, we have cabbage. Like its relative broccoli, cabbage is a cruciferous vegetable packed with natural substances called indoles, which have a powerful influence on how your body processes estrogen. When consumed too frequently, it can disrupt your delicate hormonal stability. These indoles work by speeding up the removal of estrogen from your body. This requires a careful balance. For a man in his later years, testosterone levels naturally decline, and estrogen plays a vital role in maintaining brain function, bone density, and heart health. Drastically shifting estrogen levels creates a hormonal seesaw effect. This instability can disturb the peaceful, inactive state you want your prostate to maintain. The risk emerges from habits like eating raw cabbage daily, having large portions of sauerkraut regularly, or taking concentrated indole supplements. To safely include cabbage, enjoy fermented options like sauerkraut as a small condiment. Incorporate cooked cabbage into your meals a couple of times each week. You should never take indole 3-carbinol supplements without the direct supervision of your urologist. Next, we turn to a nightshade vegetable where how you store and handle it makes all the difference. Eggplant. What many men do not realize is how much its safety depends on ripeness, handling, and storage. When eggplants are unripe, bruised, or stored in too much light, they build up compounds called glycoalkaloids, mainly solanine. Solanine can disrupt the structure of your cell membranes. When that happens in small amounts over time, it can keep your body in a state of low-grade inflammation. Chronic inflammation is one of the known factors that can speed up prostate cancer progression. You can easily minimize this risk. Always choose eggplants that feel firm and heavy for their size. Look for skin that is tight, glossy, and has a deep, uniform purple color with no green patches. Once you bring them home, store them in a cool, dark place and use them within a few days. Peeling the skin and salting the slices before you cook them can further reduce any potential alkaloids. A fresh, ripe, and thoroughly cooked eggplant is a perfectly safe and nutritious food. Speaking of greens, let's examine lettuce. It seems like one of the safest foods on the plate. However, the way we grow lettuce today, especially tender varieties, can cause it to absorb and hold high levels of dietary nitrates from the soil. When nitrates from lettuce enter your body, they can turn into nitrites and then into compounds called nitrosamines. That process speeds up when stomach acid is low. Many men in their 60 seconds and beyond have reduced stomach acid naturally, or they take acid-blocking medications for heartburn. Lower acid allows more nitrates to make that chemical jump, which leads to higher levels of nitrosamines. Nitrosamines are powerful cancer-causing agents. They can directly damage the DNA inside your cells. As the years go by, your body's natural ability to repair this kind of genetic damage slows down. The solution is to vary the greens in your salad bowl. Rotate lettuce with arugula, spinach, and mixed spring greens. My most important tip is to always add a source of vitamin C to your salad. A generous squeeze of fresh lemon juice over the greens can help block the formation of those harmful nitrosamines right in your stomach. We are now going to look at the final two vegetables, starting with tomatoes. Tomatoes carry lycopene, a powerful antioxidant. In reasonable amounts, it can support prostate health. When intake gets too high, it can present a different kind of challenge. The issue arises when you get lycopene from concentrated supplements or by consuming very large amounts of tomato paste daily. At these high levels, lycopene may begin to interfere with a vital natural process called apoptosis. This is your body's programmed way of cleaning out damaged or dying cells. If this cleanup process is dampened, those compromised prostate cells might stick around longer than they should, potentially accumulating more damage. The safest and most beneficial way to get lycopene remains through whole food. A moderate portion of cooked tomatoes, such as in a sauce with a little olive oil, is the ideal approach. Favor whole tomatoes and simple sauces over concentrated pastes or extracts. Skip lycopene supplements unless your doctor specifically recommends them. This brings us to our final vegetable, number 1 on the list: celery. It carries a clean image. What rarely gets mentioned is that celery contains active plant compounds called furanocoumarins and epigenin. One of these compounds, psoralen, works by causing stress inside a part of your cells called the endoplasmic reticulum. Think of this as the protein-making factory inside each cell. When this factory is under constant low-level stress, the prostate cells can become resistant to the important signals that tell them to self-destruct if they become damaged or cancerous. It is as if the cells become hard of hearing. The significant risk appears in men who have adopted the habit of daily celery juicing or who consume very large quantities of raw celery consistently. This practice concentrates the psoralen, creating a persistent state of low-grade cellular stress. You can absolutely continue to enjoy celery. Moderation is what makes the difference. Sticking to normal servings and avoiding daily juicing binges helps keep its benefits without overwhelming your system. I know that was a lot to take in. I want you to understand that this information is not meant to scare you, but to empower you. The man you are today has a body that operates differently than it did decades ago. The way your liver processes compounds, how your kidneys filter waste, the delicate balance of your hormones, and how your cells repair their own DNA, all these systems have evolved. Honoring these changes is the most powerful step you can take in caring for yourself. This new approach is not about living in fear of your food. It is about living with intelligence and intention. Your strategy rests on 3 simple principles: timing, dosage, and interactions. Think of it like a glass of red wine with dinner compared to a bottle of vodka. The dose and the context determine whether it helps or harms. Did you notice a pattern as we went through the list? The highest risks almost never came from the whole vegetable on your plate. They came from concentrates, supplements in capsules and powders, or large glasses of juice. These megadoses bypass your body's innate wisdom. Choosing the whole food in its natural form is almost always the safer and more intelligent path. You now have the knowledge to move forward with confidence. We have covered 9 vegetables today. Remember, the message is not to eliminate these foods. It is to embrace them with a new level of awareness and respect for your body's unique needs.